Let's talk about baby first aid and CPR, guys. We're going to whip through this and you will be free. I know it's a really long day, so thank you for hanging in with me. This is our shortest section, it's our final section. So, first of all, how do we know that your baby is thriving, right? They are feeding well, okay? They are sleeping well. They are settling well in between feeds, right? They are gaining weight, right? These are all things that are an indication to us that baby is doing really well. They're having those 6 to 8 wet and or dirty diapers within a 24-hour time frame. So we know that they are, putting on weight in intervals, right? With the exception of that first week where they can actually lose up to 10% of their body weight. That's considered a normal weight loss. But by the time they're 2 weeks old, we want them to regain their body weight. So when would you need to be worried? When would you need to be concerned? If your baby has a temperature, and this slide says 99.8, but this is a question that you want to ask your pediatrician because some pediatricians have slightly different guidelines. Some pediatricians will say if your baby's temperature is over 100, I want to know. Some will say over 100.4, right? Some will say 99. So you want to ask your pediatrician, at what point do you want me to call you if I take the baby's temperature? What's the number that I want to, get on the phone and call you for? So that's a really good question for your pediatrician. If your baby, what you know to be normal for your baby now changes. So if your baby's not settling down like they normally do, right? They start looking almost like they're irritable or they're in pain, like if they're arching their back and you feel like you're not able to calm the baby down like you normally do. If the baby seems to not want to feed or they're not feeding efficiently, right? If the baby is having less than that recommended 6 to 8 wet and or dirty diapers in a 24-hour period, you want to, for sure let your pediatrician know. Anything that is different from the baby's normal bowel habits, right? Like a baby appears like they're trying to go to the bathroom, but they can't. They're making noises. Right? That can be a sign of constipation. They're having a hard time passing their stool. If your baby has not reached back to their birth weight by 2 weeks of age, you're going to know that because your pediatrician is going to tell you that. So that's not something that you need to monitor at home on your own because you're going to be seeing your pediatrician so frequently after you have your baby. So what do we do? Right? What do we do if we're concerned? For a high temperature, you want to call your pediatrician, right? You're going to make an appointment. Or, if it's after hours, I would say call your pediatrician. Find out if you need to bring your baby to the emergency room or if that's something that can wait until the morning and see your pediatrician in the morning. If your baby's not really settling down like they normally settle down, think about the things that babies, what are babies' needs? Are they hungry? Could the baby have a dirty diaper? What's the room temperature like? Is it too cold, too hot, right? Is the baby maybe overtired? Is that a possibility? If your baby's not feeding efficiently, do you need some kind of feeding support? If you're breastfeeding, do you need to speak to a lactation consultant? Could it just be that your baby's actually sleepy and hasn't really had enough sleep, and that's why they're not settling in as normal? Does your baby have any yellow undertones to their skin? That could be jaundice, right? That's a reason to talk to your pediatrician. Here's the other thing that's not contained in this slide, but I want you to be aware of. If your baby's very lethargic, like hard to wake up, and you know that your baby's been alert, but now your baby is very limp and lethargic, that can be an early warning sign that something is very much not right, and you want to check in with your pediatrician. If your baby's having less than the recommended numbers of wet and or dirty diapers, like how's your feeding going? What's your baby's temperature? Like usually if baby's dehydrated, their temperature will be a little bit higher. If baby is afebrile, doesn't have a temperature and maybe not feeding well, could it be something with your breast milk production, or is there something else going on that you might need to link in with your pediatrician about? So talk about like a change in the difference with baby's bowel habits, right? Is baby appearing constipated, or is the baby having trouble passing their stool, right? You can try like little bicycle legs, like moving the baby's legs in a sort of clockwise motion, to see if that'll help alleviate some of the pain in their belly. But if you're concerned, definitely you want to link in with your pediatrician. Your baby's weight, we talked about, will be recognized by your pediatrician, so I don't want you to worry so much about that, because you'll have a plan before you leave the pediatric office on what you need to do if your baby needs to gain weight. If you're concerned, baby's unresponsive, baby's not breathing, or baby's struggling to breathe, right? We have to think about, what do we do in that instance besides panic, because anybody in their right mind would panic, right? Very simple, step by step. What do we do? Number one, you pick up the phone, you call 911, you tell them exactly what's happening. And then we're going to show you the initial first steps of like first aid while you're waiting for medical help to arrive, right? So the initial steps of first aid, what is it? It is essentially the very initial steps that are given to someone who's, impaired and needs help before the arrival of qualified medical personnel. Ambulance response time can be slow depending on where you live, right? I know in New York City, it can take, 45 minutes to an hour for an ambulance to get to somebody. So, what do you do in the meantime? You want to know what you need to do. Let's talk about some of that. So when an issue arises, what do I do first? When do I call for help? What order do I do things in? And oh my God, like, I'm so confused. How do I make it happen? So follow the golden rule, right? Which is, what's the danger, right? What's the response? Does the baby have an airway? Is the baby breathing? Do I need to do CPR? Okay. So let's talk about that. Is it hard to remember? Look at the first letter of each word, right? So danger, response, doctor, ABC, airway, breathing, CPR. Okay, so if you remember Dr. ABC, that's going to help you remember. Okay, the D, danger, the R, response, ABC, airway, breathing, CPR. All right, so assess the situation, right? For the danger to you, your baby, anyone around. If it's too if it's too dangerous to attend to your baby, you're going to pick up the phone, dial 911 right away. If you can move your baby to a safer location, now is the time to do that. So how do you check your baby for a response, right? You're going to tap your baby and you're going to talk, okay? If this is my baby, I usually call her Piper when I do my baby care classes. Piper, 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 are you okay? Are you all right? Right? And if Piper is sitting there like this, she's not okay, right? If she picks up and opens her eyes and cries, she's all right. She can breathe, right? So if your baby responds, you want to place your baby in what's called a recovery position. We will learn this, all right? Ask someone to call 911 or do it yourself if you need to, and then remain with your baby until an ambulance arrives. What is the recovery position? Recovery position is essentially cradling your baby in your arms with their head tilted slightly downwards, not upwards. Okay, recovery position. Baby's head is tilted slightly downwards, head is well supported. That's considered recovery position. All right. If your baby has no response, there is lethargic, no response, you don't know if your baby's breathing, you want to make sure that you are shouting for help. You are asking someone to call 911. If nobody is available, pick up your mobile phone, dial 911, put it on speaker, and don't ever leave the baby alone. You want to check the baby's airway. That means we're checking to see if the baby is able to have an open airway where we could perform CPR if needed. Without a clear airway, your baby will not survive. Okay. So we want to make sure that we have a patent airway. Your airway is everything. Open your baby's mouth, open it up, look inside, right? Is there vomit in the baby's mouth? Is there blood in the baby's mouth? Is there a foreign object in the baby's mouth? Obviously, there's not going to be a foreign object, with a newborn, but and a baby that's, 7, 8, 9 months old. Is there something in the baby's mouth? If there's vomit or blood, you want to turn the baby's head to the side and gently try to remove with a finger, right? Swipe the mouth, try to get everything out. Call 911 if you need to. Is there a foreign object? You want to try to remove what you can see in the mouth. if you can't, right, you can't get anything out, you want to see if you can get that baby to cough, right? Observe for coughing. If there is noisy coughing, you're going to let whatever is in there come up. If a baby can cough, they're generally okay. But if there is silent coughing, something stuck, right? We're going to end up doing back blows. We're going to learn how to do that. Let's say you look in the baby's mouth, you're checking for an airway, you see nothing. Generally, you have a patent airway. All right, back blows, chest thrusts. So you want to lower your arm onto your thigh, right? You can't really see me doing that, but I'm lowering my arm down. You're going to take your baby so that the head is lower than the chest. All right, let me show you this. Let me stand. All right, so here's what I'd be doing, right? I'm putting my arm right on my thigh. Head is lower than the chest. And I'm going to go ahead using the heel of my hand, 5 firm blows right between the baby's shoulder blades. So it's 1, 2, 3, 4, 5, right? That's pretty firm, you guys. Right? You hear that, right? 1, 2, 3, 4, 5. You are not going to hurt that baby. What we're trying to do is dislodge anything that's in the mouth, right? So you want to then turn the infant, right? Turn the infant, and then with 2 fingers, you're going to deliver chest thrusts, which end up being right below the line of the nipples. You look at the nipple line, you go right below, and then 5 of them. 1, 2, 3, 4, 5. So that pattern actually gets repeated if we think that there's something stuck inside. So the aim of clearing the airway is to make sure that your baby's breathing. But what if the baby's not breathing, right? What if you're looking and you don't see that baby breathing at all? You see that baby starting to turn blue, right? Make sure you're correct. Turn your baby's head, put 2 fingers underneath the baby's chin, right? Lift the head slightly, right? Look, listen, feel. So you're looking, turning your ear, listening, right? And you're feeling for, is there any breath coming onto your chest? Okay. So is your baby's chest moving? Can you hear the baby breathing? Do you feel the breath? If the baby is breathing but unconscious, we're going to go ahead and put the baby in that recovery position, right? Either this way or this way, head lower than the body. All right. If the baby is not breathing, we got to do CPR. It's our only option, right? So when we're talking about CPR, take a look at this slide. I want you to see the position of the fingers. Okay. So look at the nipple line. You're going just 2 fingers below the nipple line. Now, some people use these 2 fingers. Some people use the 2 middle fingers, right? So I always say you can line up the nipple line with your first finger. You know where that is? Then use your 2 middle fingers, okay? And you want to go on the lower third of the baby's breastbone, okay? And you give compressions. You are pressing down relatively quickly. Let me move my doll so you can see. All right. So when you're giving compressions, 30 compressions at a speed of 120 compressions a minute. In reality, if you really needed to give CPR, and I've been in this situation, you're not really counting, right? All you're doing is pressing 1 and 2 and 3 and 4 and 5. That's a really great way to time it, right? 1 and 2 and 3 and 4 and 5 and 6 and 7, right? Just put an and in between, and you're giving those compressions, right? After 30 compressions, right? Because eventually you're going to start counting. So if it's 40, it doesn't matter. Eventually you're going to start counting 30, right? 1 and 2 and 3 and 4, all the way up to 30. Then you're going to end up breathing over the baby's nose and mouth, right? 2 breaths. So right over the baby's nose and mouth, 2, right? Another one. So your whole mouth goes over the baby's whole nose and mouth. And you're going to repeat that cycle. 30 compressions, 2 breaths, 5 cycles. Okay? 30 compressions, 2 breaths, 5 cycles. All right? And that's going to take you approximately 2 minutes. So then we're going to check for a pulse, right? And again, look, listen, and feel. How do you check for a pulse? How do you do that in a baby? Could put your hand right over their chest and feel for their heart beating, right? It's not as difficult as you think. You want to actually just put your hand right over their belly, or right over their chest rather, and feel for a pulse. Okay. Now there are other ways to feel for a pulse, right? You can feel it in the wrist, but in a newborn, that's really difficult. You can feel it in their feet, but that's very difficult. So right over their chest. You can also feel in the carotid area, but on a baby, that's hard. Right over their chest is usually the easiest way. If there is no pulse, you are absolutely going to continue that cycle, 30 compressions to 2 breaths until medical help arrives, right? So don't wait for medical help to come before you start CPR. In many cases, you're going to start CPR until medical help arrives. All right. Let's talk about, again, like, this isn't a CPR certification course, and I would encourage you to take one where you can actually practice on a little model baby so that you feel comfortable and competent. Because let's be honest, when we're in that situation, we are all going to feel completely incompetent because none of us know what we're doing, right? You have to have done it once or twice to actually, feel like you can do this without losing your mind. And even when I have to do it, even in the hospital before a pediatrician arrives, it's still 30 years of experience. It's still nerve-wracking for me too, because you never want to be in that situation, right? Let's talk about accident prevention. Crawl around on your knees and see what trouble you can get into. Are there cords plugged into outlets that your baby could crawl and get their hands stuck into the outlets? Do you need outlet covers? It's a really good way just to get down on the floor and crawl around, see what kind of trouble you can get into. Are there sharp objects? Is there water in the toilet, right? We got to remember to keep the toilet seats down so babies don't end up crawling up into the toilet and falling in. What kind of heavy items can a baby crawl onto that might fall down on top of them? To a young child, 7 months, 8 months, a year, 15 months, those little pods that we put in the dishwasher or we put in our washing machine, those can look like candy to newborns. They can look really interesting. They're bright in color. Everything goes into a young child's mouth. So we want to be careful. Are there blind cords, curtains, things that babies can pull down and end up hurting themselves? So we want to just crawl around and see if there's anything we can do to minimize, the sort of, I say, like, risks in the household. Let's talk about car seat safety for just a minute or two. So we talked earlier about the National Highway Traffic and Safety Administration, NTHSA website, and click on child safety in cars. Straps should be quite tight so that it's not so tight that your baby is uncomfortable, but they should be very tight so that you can't pinch the harness strap between your thumb and your forefinger. Okay, so right here, the harness strap, you can't pinch it between your thumb and your forefinger. You want to make sure that the chest clip is slid up to the baby's armpit level, right? We don't want the chest clip to be very low. It needs to be up here, up by the baby's armpit level. We want to make sure that the newborn insert, which is around the baby's head, is used until the baby can support their own head. And that is different for each baby, depending on how strong your baby's neck muscles are. Only use what comes with the car seat. Don't use your own sort of, I don't MacGyver it, right? You guys are too young to know MacGyver. Don't make your own, pillows with like baby blankets, or use baby pillows inside the car seat. Only use what comes with the car seat. Don't use anything aftermarket like bumper pads or inserts inside your car seat. You want to make sure that the anchor system on the base in your car seat is secure and it fits correctly. And again, remember I said you could go to your local police station or fire station if that is a service that they offer to the community. You want to make sure that your car seat has a mark from that says, inspected, or it has a national safety mark. That way, you're getting one that has been recommended and approved by the National Highway Traffic Safety Administration. Make sure that your car seat is designed for traveling and not made to be a place where your baby sleeps. Newborns, especially, who don't have really strong neck muscles, can pull their chin forward and actually block their own airway just from sleeping in a car seat. So that is something that you want to be very sort of mindful of. And know that it's really not recommended to have your baby in a car seat continuously for more than 2 hours at a time. If you're going on a long trip, you want to actually remove them from the car seat even for a short period of time, maybe just soothe them a little bit, maybe, feed them and then put them back in the car seat after they've been properly burped. Make sure that you dress your baby normally when you put your baby in a car seat so that they're comfortable. And then you want to cover the baby with blankets over the harness as opposed to blankets underneath the harness and the harness over the blankets. So harness your baby in comfortable clothing and then blankets on top as needed. Okay. Snowsuits, like fluffy clothing, puffy stuff, really are not ideal for car seats. They definitely make car seat covers that are fleece that will keep your baby actually quite warm inside the car seat if they're just wearing normal clothes. All right, let's talk about like baby slings, carrying your baby in a baby sling. The acronym, remember we talked about all the acronyms that we use here at the Baby Academy, is TICKS, TICKS. So the T stands for you want it to be tight against your body. You can see this is a very common one called a Snuggly. Those are commercially available. And so are these slings that actually are quite long pieces of fabric. It's almost like a baby wrap, and they give you instructions on how to wrap your baby up. You just want to make sure that what you're using is tight to your body. So that's the T. The I is your baby is in view at all times. You can look down, you can see your baby clearly. The C is your baby is close enough to kiss. So I don't want my baby down here by my abdomen, right? If I'm going to use a sling or a wrap, I want my baby close enough where I can drop my head, I can kiss my baby, right? That's where I want them, not down here. Okay, up high. Okay, the next one is, keep their chin off of their chest. We don't want babies' heads like this. We want their heads to be up so that we're not blocking their airway. So if I were going to put a baby here, I would turn their head to the side, right? I don't want my baby like this. I want their head to the side so that their chin is not coming forward. They're wrapped up, right, against my skin, and I can hear, see, lean down, kiss the baby. All right, and the S is make sure their back is very well supported. You can see that in both of these slides here, both these pictures. Baby's back is very well supported by the Snuggly here and very well supported by the baby wrap in this left-hand picture. All right, so I'm always amazed when I stay on target here. So we have 10 minutes or so for any questions about first aid. So we're going to open up that live chat. Send me your questions. And if you have questions above and beyond anything about first aid, because I know we went through it relatively quickly, I am happy to answer those questions. Okay, let me make sure that we open up the chat here. Okay, so, all right, I'm looking for your questions. I've asked them to open up the chat for us. It takes a minute or so. Okay. Amy and Robert, MacGyver. Thank you. Thank you. I don't feel so old anymore. I say that all the time. It was so funny. I'll tell you a funny story. So I had a patient yesterday in labor who ended up with a C-section. And I like when we have to do C-sections to play music. I think it relaxes the parents oftentimes. So I said, what kind of music do you want? She's like, I don't know. I said, how about a little bit of James Taylor? Like he's pretty chill. And she goes, I don't know who that is. I said, oh my gosh, I'm feeling old. They didn't know who James Taylor was. I did many years. I trained in Philadelphia, and James Taylor, who's an amazing vocalist, used to come every year to the Mann Music Center in Philadelphia, which is a very small venue. It's very personal, and he would do a lot of a cappella, just sort of acoustic work. And it was so amazing. And so I love his songs. And if anybody knows who he is, you know what I'm talking about. But I thought it was so funny when that couple was like, I don't know who that is. I thought, oh my God. Okay. Anu, do you share the slides? Yes, you will get an email this upcoming week. You're going to get a recording of this entire class. So 100%, you will get to hear my lovely voice as often as you'd like over the next 6 months, and you will get a copy of our slides. So when we do the baby first aid, we do it actually relatively quickly. So I do think that it makes sense to just go back and review the slides to feel comfortable with it. Can you use LifeVac on newborn for choking? Laura, you know what? I am not 100% certain of what the LifeVac is. That's something I would have to look up, but what I'm going to recommend is that you email that question to our content experts at yourbabyacademy.com, and they will 100% get back to you with an answer. Is there anything you can give the baby for an allergic reaction? So yeah, definitely. But I would tell you that you'd want to talk to your pediatrician before you give any medication to a baby. Oftentimes babies can take Benadryl. You know, Benadryl is given oftentimes for allergic reactions, pretty benign, but you don't want to go ahead and make that decision to give that to your baby without talking to your pediatric healthcare provider. So you'd want to talk to them first about that. Okay, Chelsea, great question. Chelsea says, what baby-proof stuff should we get for baby and when to get it? Look, it is always easier to get stuff before your baby's born, but a lot of times, like the stuff that you think you need doesn't turn out to be what you really need. So the stuff that you would want to get for when your baby actually gets a little bit older, you definitely want the little clips that clip your toilet seat, the toilet seat cover to the toilet seat, so babies can't open up the toilet seat when they're starting to stand up and hold things. They can't climb into the toilet and get in trouble and drown. You definitely want outlet covers on any outlet that is baby height level. We don't want babies putting their fingers into outlets. You want to get on the cabinet doors that your baby could get into and pull anything out. I remember one time my 3-year-old, when I was we were having construction done in our apartment, and I was in our house, and I was staying in an apartment, and they didn't baby proof the apartment. And my 15-month-old actually got into a lower cabinet and drank plant food. Talk about scared to death, poison control, emergency room, and all I had to do was put little clamps on the counter or the cabinets so that the doors wouldn't open, right? So live and learn. But yes, you want to make sure that they make little clamps that you can put around the pulls on your cabinet doors that only an adult can open. Not newborns, but young children can't do that. So that keeps them safe from getting into cabinets where they shouldn't. I also say, like with drawers, babies like to pull on things, but they can get their little fingers stuck. So you want to make sure that you have something to keep your drawers closed so they don't lean forward and get their little hands or their arms stuck. Okay, Erin, what do we do if baby gets a cut or a bruise? The same thing you would do if you got a cut or a bruise. So if baby gets a little cut, you're going to apply pressure with a tissue, paper towel, little first aid gauze, and you're going to wait for the bleeding to stop. So I usually apply pressure for about 20 to 30 seconds, and then you're going to lift that off and see if they are actually still bleeding. If bleeding continues, again, pressure again. For another maybe 30 to 40 seconds, lift it up. If baby is still bleeding, call your pediatrician, right? That is an indication, if you cannot stop bleeding, that you want to call your pediatrician. What do you do if baby gets a bruise? So you can you're going to have to call your pediatrician to ask them, what you can actually use to actually help with bruising. My pediatrician uses arnica a lot, like an arnica topical ointment. And he's a holistic pediatrician, so that's a good option. But you'd want it, call your pediatrician first to find out at what age they think that is acceptable to use. Okay, for a diaper rash, can you also use petroleum jelly? If yes, how do you use it? So what I would use for diaper rash is more an A&D ointment than petroleum jelly. So I think now we're starting to get away from using petroleum too much. But yes, I would say A&D ointment is a better option for diaper rash, but great question. Okay. Aisha, I've heard some say that the baby should be swabbed with vaginal fluid after a C-section. Is that necessary or even beneficial? It's a great question. And that is called seeding. When when babies come through the vagina, they're exposed to all the bacteria that is in the vagina. And that may have some beneficial effects. That's the thought process, that may have some beneficial effects, meaning that babies can start to build up some antibodies to the bacteria naturally. When a baby is born by C-section, they're removed, so they don't come through the vaginal canal and they don't get that benefit. So this is the idea behind seeding. That is, if you take a cotton swab and you put it inside the vagina, right? And then you take that cotton swab and you put it inside the baby's mouth. That mimics the baby coming through the vagina. Now, do I think that that really mimics it? I don't think it exactly mimics it. I will tell you that there is no hospital that I know of that will tell you they will do that for you. They're not going to put a cotton swab in your vagina and then put that in your baby's mouth. Why? Because there's so much bacteria in the baby's vagina. Is that something that you want to do at home? That's going to be at your own risk, right? So it's called seeding. You can look online. There's lots of information about it, benefits, risks. It's something that you might want to talk to your pediatrician about. Is that something that they would recommend? Most of the pediatricians that I know do not recommend seeding at all. They, talk about the natural process of labor versus the process of C-section. Do we really find that babies who are born by C-section are at any higher risk of infection? No, we actually don't see that. That's not what the studies say. So that is something to discuss with your pediatrician. Okay. All right. How do you ID an ear, meaning how do you identify an earache? So a lot of times babies will get very irritable when they have an earache. Sometimes their hand goes up to their ear, right? It's almost like I don't know if you have pets, but if you see a dog or a cat, start to take their paw onto their face, it's because something's wrong, right? Babies will oftentimes do the same thing. They're not going to pull. An older child will pull, but a newborn might be doing little things like that on the side of the face. If that's the case, you might want to call your pediatrician and say, this is what I'm noticing. Babies with earaches oftentimes don't feed all that well. They also don't sleep all that well. So you're likely to see those symptoms as well. If you see those things, you want to link in with your pediatrician. What kind of baby thermometer should we use? Great question. I like, for newborns, I like digital thermometers. I don't like the point and shoot ones that everybody has, in every location during the pandemic. I don't think they're nearly as accurate. I think that the digital thermometers, and this is just a pen, but digital thermometers, have a little button that you press to turn it on. You put it underneath the baby's arm. You hold the arm steady. It will beep when it's done registering the temperature. Simply take it out and you will see right on the screen what the baby's temperature is. You would need to report that to your pediatrician, but also to tell the pediatrician how you took the temperature. So I would say, hi, Dr. Smith, this is Chris. I was concerned my baby might have a temperature, so I did take it under the baby's arm. Temperature was 99.8. Is there something I need to worry about? So taking the baby's temperature, not only what the temperature is, but how you took it. I don't recommend doing rectal thermometers for new parents because even experienced parents can sometimes insert a thermometer a little bit too far, and then you can cause damage to the rectum or the intestine. So I really do like digital thermometers right underneath the baby's arms. All right, quick thought. What do we think of the electric snot removers for the baby's nose? Brianna, listen, I think it's an option. I don't necessarily think it's something that you need to have. Like usually in the hospital, they're going to send you home with the little bulb suction, and those are really adequate. Like the electronic ones are, to me, like, while it's something that you could have, you could probably spend that money on something that's going to be something you're going to use more frequently. So I just use the bulb syringes. That's all I used. The one they use at the birth, they will give you to bring home, and you can just bring that home with you. Okay. What do you do if baby gets a cold? Same thing that you would do if you get a cold, right? It's supportive care. You make sure that baby is drinking enough fluids. You make sure that they're eating well. Maybe take a trip to your pediatrician and see if there's anything else that you can do for support. But babies do get colds. I mean, they cough and sneeze a whole bunch after they're born because they're still trying to rid themselves of that fluid that they were living in, that amniotic fluid. So they do that by coughing and sneezing, and that's often mistaken for colds, but it's actually not a cold at all. It's just them getting rid of that excess fluid. Great question, you guys. Listen up. Can baby be taken to a beach if a cover is used? No direct sunlight for the first 6 months. So this is also a great question for your pediatrician. Most of them will say as long as the baby is under a cover where they're not being exposed to direct sunlight, it is fine. Sunscreen is not recommended for babies for the first 6 months after they're born. Do I recommend taking probiotics before the Group B strep test? Yeah, probiotics are a great option. Does it help prevent against Group B strep? I would have to look at the most recent data, but the jury was sort of still out on that about a year ago, whether probiotics actually minimize the risk of developing Group B strep. What I tell my patients is this. Group B strep is really common. I usually say if you and I both have a vagina, the likelihood is one of us is going to culture positive for Group B strep. That does not mean that there's anything wrong. It changes your labor management just a little bit. Just means that we need to give you antibiotics when you're in labor and when you're in active labor, because Group B strep is only an issue once your water bag breaks. Baby has no chance of contracting Group B strep while your water bag is still intact. So sure, probiotics are certainly not going to hurt you in any way. Best way to avoid SIDS. In the early 90s, there was a back to sleep campaign that was enacted, and we have decreased the risk of SIDS by over 80%. So the best way to prevent SIDS is to put the baby on their back to sleep. We cover that in our infant care workshop. That's a free course you can take, but we do have a whole section on safe sleep in that course. Okay, Debbie said, do we wake the baby to breastfeed or let them sleep? We talked about that earlier. I personally would not, I wouldn't let a baby sleep too long, especially in the first 4 to 6 weeks without being fed. So if you're consistent about breastfeeding every 2 to 2.5 hours, or bottle feeding every 3 to 3.5 hours for the first 4 to 6 weeks, then you can let that baby sleep for a max of about 4 hours at a time without getting them up for a feeding. After about 6 weeks, once your baby hits about 10 pounds, which is somewhere between like 6 and 10 weeks, you can start to sleep train them, right? So they really don't need to get up at night at that point once they hit 10 pounds. So that's the magic number, 10 pounds, and they're likely not to need to wake up at night to feed anymore. They're kind of just waking up out of habit. All right, guys, we did it. You made it through. It's like labor twice. If you can sit through all this, you can absolutely 100% make it through labor. So I hope that you stayed engaged. I hope it was interesting enough. I know I talk a lot. There's just a lot of information that I want to get in. So I want to thank you for coming. I wish you all a really lovely, happy, healthy delivery, healthy baby. And thank you so much for your attention today. All right. Have an amazing rest of your weekend. Take care.